Sumen Dheer. I am working as interventional cardiologist at Narayana Multispeciality Hospital, Ahmedabad, and I am here to share with you some insights and some inputs on the heart problems which people have, and how to get over the problems once you have a heart attack. What is the hospitalization? What are the treatment modalities, and what should the patient take care of once he's discharged from the hospital? So the burden of heart problem is huge in India. That is, can say, as per the statistics, almost 25% of all the deaths the stressful working conditions, higher incidence of hypertension and diabetes. Whereas in the rural areas, I would say a major factor for this is the increased incidence of smoking and usage of tobacco, which is also equally problematic in the urban or in areas or in the cities also. Now, the conventional risk factors for heart attacks or heart problems we all know is like as I said, smoking, tobacco use, hypertension, uncontrolled diabetes, obesity, sedentary lifestyle, stressful working conditions, and a lot of times strong family history. It is well known that genetic factors play a very important role in people getting heart problems at early stage. Now, if you have a family member or a close family member who has a heart problem or a diabetes or hypertension, it's very common to have that other family members may be suffering from hypertension and diabetes. Same is the case for higher cholesterol levels also. People who have a genetic predisposition to high cholesterol levels also have high incidence of heart problems. That is, compared to Europeans, the diabetes comes much earlier in us, and the diabetes is very severe. For the same reason, we get heart problems almost a decade earlier than those people in the European or on the in the America or in the European countries. So not only the heart problems are more prevalent in India, they come at an early age also. Now, the presentation of heart attack can be different, and the patient may be admitted to the hospital either with chest pain or with breathing difficulty or with the symptoms of heart failure. Now, once the heart problem has been diagnosed and the treatment has been done, the treatment modalities may be either medical management, that is treating with drugs and the ICU care. It can be along with medical care, it can be interventions such as the patient may undergo an angiography or an angioplasty. The patient may undergo a bypass surgery, especially in those people who have multiple blockages or who have long-standing diabetes and arteries or the patient, the kind of heart attack which the patient had, the kind of the intervention patient has undergone, whether it was an angioplasty, where the discharge is usually within the next 2 to 3 days, or if there's a bypass surgery, the hospital stays a little longer. Now, depending on the comorbid conditions, that is, the patient is also suffering from uncontrolled diabetes or lung problems or kidney problems, the stay in the hospital usually is longer and it is more pronounced, and the medical care is also more longer. So, depending on the patient's profile, the age, the risk factors, the severity of the heart attack, what kind of intervention or surgery or medical care patient has gone through during its stay in the hospital, that there are some certain things which have to be kept in mind once the patient comes home. The most important question what people ask is, should be always a dietitian who should give you a diet pattern or a diet chart depending on the patient's age, the profile of the patient, the body weight of the patient, and his caloric requirement. Broadly, it we said that you have to avoid fatty foods. Once you are home, you have to avoid foods which have got high amount of the fatty substance and the salt, like chips or cheese. You have to increase your proportion of fruits in your diet. If you are a diabetic, you have to consult your dietitian or your diabetologist before you decide what amount of fruit and what kind of fruits which can be consumed. Increased amount of salad intake is always desirable. Fatty foods, as I already said, have to be have to be controlled. People who are who are fond of or who are in a habit of taking ghee and all, is a very common question which they ask, whether they can consume ghee or not. A simple explanation is that, say, most of the oils are not bad. It is the quantity of the oil which has to be controlled. So ghee has got a lot of good properties also, along with the fact that it has got high amount of saturated fatty acids. So if you use ghee in what the patients are. Now, physical as well as mental relaxation and rest is very, very important in patients who are recovering from a heart attack, either who have undergone surgery or who just received medical care. So, classically, 2 to 4 weeks of rest, I would not say bed rest, but 2 to 4 weeks of physical rest is required for these patients, so that the heart function improves. There is no physical stress on the heart rate and the blood pressure is under control. So once the patient is comfortable, after 2 to 4 weeks, they can start with light activities like light walking, light jogging, short distances of cycling, depending on the profile of the patient. If the patient's heart function is not so good after the episode of heart attack, then even the exercise program has to be even more gradual. That is, the starting of the exercise, starting of physical activity has to be more gradual. So in broad, physical and mental strain should be avoided for at least 2 to 4 weeks in patients who have come home after a heart attack. You have to get in touch with your the specialist or a person who takes care of your exercise program to get back to work. Second would be the third thing after diet and exercise, I would say, would be about the medications. Now, a lot of patients ask us whether they have to continue the medication for lifelong or whether they are temporary medications which are given have been prescribed to them. Now, blood thinners and anti-cholesterol tablets have to be taken on long-term basis. In most of the patients, these are the medications which have to be taken for life to prevent future episodes of heart attacks and to prevent increase in the disease pattern which can occur. Now, diabetic patients have to take the cholesterol tablet lifelong, irrespective or bad cholesterol. They are also helpful in strengthening the vessels, the coronary arteries. They improve the endocrinal function, or they improve the working of your arteries which supply blood to the heart. So cholesterol tablets have to be taken lifelong. If your cholesterol levels are not controlled with the usual doses of the drug, the dose has to be increased in consultation with your cardiologist or with your physician. Physician, keep your blood pressure under control. If you have undergone an angioplasty or a bypass and you are a diabetic, it doesn't mean that the disease cannot come back. There are drugs, there is exercise program, there is your diet therapy, which is very important to help you tide over the problems associated with diabetes. But regular checkup, regular monitoring the levels of diabetes is very, very important, so that you are protected from the long-term side effects of diabetes. So having said this, I just like to summarize is that heart attack is very common in India. It's a problem not only for elderly, it is a common problem very common even in young patients also. So apart from the precautions which you take, like diet therapy, your diabetes and blood pressure control, quitting of smoking and tobacco, if you happen to have a heart attack and you have undergone a procedure, an angioplasty or a bypass or simply medical care, you have to keep in mind that it is not the end of the road. You have to keep working on your diabetes, your blood pressure, your health. You have to have a continuous exercise program where you can take care of your diet, take care of your exercise, take care of your aerobic exercises, so that you are protected from long-term side effects of incident high proportion of sodium. So I would say is that rock salt can be used, but now if you go and see in all the major shops or supermarkets, low sodium salt is available under various brand names. So if you have to have salt in your diet and you're not able to control it as you want it to be or as you wish it to be, rather switch over to the low sodium salt which is available in most of the shops these days. At what duration the regular checkup should be done? Now, regular checkups depends upon your cardiologist or your treating physician. Uh, Classically, I normally call the patient after 1 week of an acute episode of heart attack once the patient goes home. Thereafter, my visits are usually spaced after 2 weeks, then after 4 weeks, then usually once in 3 months. And if the patient is absolutely fine, following his schedule of medications, and once in 6. People have misconceptions regarding ghee and even coconut oils also. Again, as you read, coconut oil has got a lot of saturated fatty acids also. So again, a coconut oil or a ghee, if used in lesser quantity, that is not more than 2 to 3 teaspoons a day, it is not bad for your health. So for that reason, none of the oils are very bad unless they are used in the wrong quantities. What diet do I need to follow? Diet, as I said, diets rich in legumes, in salads, in fruits. They are always good for your health, including cardiovascular health. You have to avoid fatty foods. You have to avoid French fries, chips, cheese, canned foods. All these things should the fast food should be avoided as much as possible. To the emergency department with breathing difficulty, with heaviness in the chest, with burning sensation in the chest, which is very similar to the acidity attacks. So a lot of people confuse heart attacks with acidity and acidity with heart attacks. So if you have a persistent burning in your chest, which is not going away with your conventional, homemade treatment, and if you have conventional risk factors for heart problems like smoking, tobacco, diabetes, blood pressure, obesity, you should not take these symptoms very lightly and should go to the emergency department. So heart attacks can present to you with different kind of symptoms. What can I do to feel less stress and worry less? Now this, it depends on person to person. It depends on your job profile, it depends upon your age, it depends upon what kind of industry you are working in. For that reason, it is under ultimately your self control which is going to help you. You have to avoid, if you cannot avoid stressful condition, you have to resort to therapies like yoga and meditation to bring down your stress levels. So ultimately, food, exercise, quitting your bad habits, having a less stressed out lifestyle is going to help you in preventing heart problems in the future. Thank you very much. बहुत शॉर्ट तो नहीं था?
नहीं नहीं सही था।
ठीक है, आई थिंक अराउंड 8-9 मिनट्स तो होगा.